Okay, I'm gonna go ahead and start. I'm gonna go ahead and wash my hands. I'm gonna go over my MAR. It looks like we have an order from the primary care with an order to change the CVAD dressing. I'm also gonna check the when the last dressing was changed, the date and the time of that, and then any allergies. So I'm gonna go ahead and then collect all my supplies. So we have the CVP dressing tray. Here I have a pair of my clean gloves. I have an extra pair of sterile gloves, and then I also have my patient mask. However, I don't have one in my kit right now, so we're gonna pretend. So I have all my supplies. Go ahead and collect them to go in the patient's room. Knock, knock, knock. I'm going to be providing privacy, checking out the environment to make sure it's safe. I'm going to go ahead and set this down. And then the patient responds with good affect. I'm going to go ahead and introduce myself. I'm going to wash my hands. Hi, my name is Britt, and I'm going to be your nurse today. Before we begin, I'm going to check the patient's wristband and ask them to state their first and last name as well as their date of birth. And that's good. So I'm going to also check that with the MAR to make sure their first and last name as well as their date of birth and MRN number and if they have any allergies. So that looks good. Okay. I will be changing your CVAD dressing today. Do you have any questions? Okay, so I'm gonna go ahead and prep the patient. I'm gonna go ahead and wash my hands. I'm going to raise the bed at appropriate working height. I'm gonna make sure the patient is in the proper comfortable positioning, either supine or semi-Fuller's position. And it looks like the bed's fine, so we're gonna leave it. And then I'm going to grab my patient mask here and tell the patient that they'll be wearing a mask and that it's for their protection, and also letting them know that I will also be wearing a mask later. So I'm going to go ahead and get my supplies all ready. So I have my tray here. Go ahead and wash my hands. I'm gonna go ahead and open my tray. I'm gonna go ahead and throw that away. Grab my mask. Go ahead and put my mask on. And then I'm going to put on my clean gloves. Okay. And before I remove the old dressing, I'm going to go ahead and assess. It looks like the catheter site is good. There's no infection, any redness or drainage, so I'm going to go ahead and remove that. Trying not to, going from the outside in, trying not to pull on the catheter. Okay. And I'm going to go ahead and remove my gloves, wash my hands. And then I'm going to go ahead and grab out my sterile gloves. And then I'm gonna grab up my sterile drape. I'm gonna go ahead and put the shiny side down. And then I'm gonna go grab my ChloroPrep. I'm going to grab my tape and we'll set that aside. I have my Tegaderm. I have my alcohol swabs. And then I have my forceps, actually grabbing in my left hand. And then I'm gonna grab the ChloroPrep and begin to clean the outside skin. I'm gonna crack it. So we're going to be scrubbing back and forth for at least 30 seconds, all around where the Tegaderm would be on the surrounding skin. And then I'm gonna grab the forceps so I can go under the lumen. Okay, and then we're gonna drop that. I'm gonna grab the alcohol. And then we're gonna be alcohol swabbing the hub all around. And then on top of the lumens. And then we're also going to be getting below the lumens. And we're going to get rid of that and put on the Tegaderm. We're going to set the Tegaderm going in to out so you don't get any bubbles. Making sure we're not pulling anything on. And we're going to be removing the outline. And then I'm going to go ahead and label. I'm going to be labeling, putting my initials and then the date and the time. Okay, so I'm gonna go ahead and clean up all my supplies. Away. I'm going to go ahead, take off my gloves, wash my hands, take off my mask, and then I'm gonna go ahead and rewash my hands. And now I'm gonna go ahead and lower the bed to a comfortable, safe height. And then I'm going to then reassess the site, making sure the patient's comfortable and safe. And then I'm going to give them their call light and then let them know I'll be back in 15-30 minutes to go and check up on them. And then I'm gonna go rewash my hands, and then I'm gonna go ahead and document the procedure done as well as all the assessments.